So we conducted a study in which we looked at patients who were treated with CAR T-cell therapy, and we wanted to focus on what easily measurable lab tests might help us understand which patients are likely to do well with CAR T-cell therapy versus not so well. And we know that with CAR T-cell therapy, even though it's highly effective, there is a range in both adverse effects. So some patients do well with very minimal side effects. Other patients can have cytokine release syndrome and neurotoxicity that can be more difficult to manage. Similarly, when it comes to overall outcomes, progression-free survival, overall survival, some patients experience very prolonged remissions, and other patients, the remissions are very short-lived. And so we looked at a panel of labs including C-reactive protein, D-dimer, ferritin, fibrinogen, absolute lymphocyte count, and absolute neutrophil count. What we found was that first, absolute lymphocyte count, when this was higher at baseline, patients were more likely to develop neurotoxicity, or what we call Icahn's, following CAR T-cell therapy. And the effect was actually fairly pronounced. So patients who had absolute lymphocyte counts of greater than or equal to 1 at baseline had 5 times the risk of neurotoxicity at about 25%, compared to patients who had lymphocyte counts of less than 0.5. For them, it was about 5%. As far as progression-free survival, ferritin was associated with worse progression-free survival, and both ferritin and fibrinogen were associated with worse overall survival. And what we saw was that this effect wasn't very subtle. And with ferritin, for example, having a ferritin of greater than or equal to 500 at baseline conferred about 4 times the risk of death compared to patients who had ferritin of less than 500 at baseline. And so what we concluded was that this panel of tests, fairly easily measurable tests that can be sent by any physician in an academic center or in the community, could really help us better understand which patients are likely to do well with CAR T-cell therapy, which patients are likely to have more adverse effects, and it can really empower clinicians to make a more evidence-based risk-benefit decision about CAR T-cell therapy.